Part 42, Chest Compressions in Infant CPR. Welcome to the lesson on chest compressions in infant CPR. In this video, we will discuss the steps of how to do chest compressions in infants. CPR for infants is almost identical to CPR for children, making steps for compressions just as similar. Push hard and fast just as you would for a child or adult. Step 1. Position the infant on their back on a firm, hard surface. Step 2. Move clothing away from chest. Step 3. Place 2 fingers of one hand on the breastbone right below the nipple line. Step 4. Push straight down approximately 1.5 inches, 4 centimeters, at a rate of 100 to 120 beats per minute. Step 5. Let the chest recoil to its normal position after every compression. Performing compressions correctly is essential and can be physically tiring. If someone else can help, switch off every 2 minutes while minimizing interruptions during compressions. This concludes our lesson on chest compressions in infant CPR. Next we will review giving breaths in infant CPR.